Good day. I'm here to talk about health-related grounds on the negative. Now, Ryan stated in his debate that health-related grounds do not reduce immigration. Immigrants that lawfully enter America go through a set of standard medical evaluations that will grant their entry if they have a healthy checklist. This alone is counting the amount of individuals that are able to reside in America. As many diseases are not visible and asymptomatic, the Department of Health and Human Services has designated set standards. According to Chapter 6, Communicable Diseases of Public Health Significance, USCIS, December 10, 2019, diseases of significance are gonorrhea, Hansen's disease, leprosy, syphilis, and tuberculosis. Communicable diseases that may pose a public health emergency of international concern if they meet one or more of the factors, and for which the director of the CDC has determined that a threat exists for importation into the United States, and such diseases may be potentially affect the health of the American public. If anyone tests positive for these, they will not be allowed into the country. Vaccines are also a requirement to request residency. Chapter 2, Medical Examination and Vaccination Record, USCIS, October 8, 2019, states that Class A medical condition is a communicable disease of public health significance per HHS regulation. A failure to present documentation of having received vaccinations against vaccine-preventable diseases. We also take into consideration mental health before entering the country, as this may not render an applicant inadmissible. It represents a departure from normal health or well-being that may be significant enough to interfere with the applicant's ability to care for himself or herself, to attend school or to work. It requires extensive medical treatment or institutionalization in the future. Chapter 2, October 8, 2019, also states that present or past physical or mental disorders with associated harmful behavior or harmful behavior that is likely to reoccur, and drug abuse or addiction. Class B conditions are defined as physical or mental health conditions, diseases, or disabilities serious in degree or permanent in nature. Someone that can cause harm to themselves or others is a national threat and should not be admissible into the United States. Ryan also states that it is ineffective to stop disease by not allowing people in. Just look at COVID, he says, how it has spread no matter what, even through lockdown. Well, first, the presumably lockdown was not quite a real one. In past research done in Africa and Europe, stated by Markel, Howard, and Alexandra Mina Stern, in The Forgiveness of Germs, the Persistent Association of Immigrants and Diseases in American Society, Milbank Quarterly Blackwell, published 2002. The presence of serious public health risk factors, including soaring rates of tuberculosis, malaria, and emergent or poorly understood infectious diseases, shrinking economy resources for epidemiological surveillance, and the delivery of primary care, and the recognition of the profound mental health disorders generated by genocidal practices in the war-torn countries of Africa, Middle East, and Eastern Europe. Not to mention the prospects of bioterrorism, all point to potential episodes in which the appearance of a specific epidemic disease may again be associated with foreigners. Foreigners must oblige to testing, especially COVID, or they will get deported, as they are a motivating factor to communicable diseases. Again, considering the COVID pandemic as an immediate risk, green cards process have become more strict. In Public Charge Green Card Processes and Procedures, USCIS, September 22, 2020, it is stated that to address the possibility that some aliens impacted by COVID-19 may be hesitant to seek necessary medical treatment or preventive services, USCIS will neither consider testing, treatment, nor preventative care related to COVID as part of a public charge inadmissibility determination, nor as related to the public benefit condition applicable to certain non-immigrants seeking an extension of stay or change of status, even if such treatment is provided or paid for by the public health as defined in the rule. The rule requires USCIS to consider the receipt of certain cash and non-cash public benefits, including those that may be used to obtain testing or treatment for COVID, in a public charge inadmissibility determination and for purposes of a public benefit condition applicable to certain non-immigrants seeking an extension of stay. Congress also plays an important oversight role, particularly when concerns arise regarding contagious diseases or potential pandemics. The Center for Disease Control and Prevention Public Health Activity Guidance, American Government, October 24, 2020, states that for COVID, activation of federal emergency plans may provide additional authorities and coordination needed for interventions to be implemented. State and local laws and declarations may impact how resources can be appropriated and allocated and staff reassigned. Section 319 of the Public Health Service Act authorizes state and tribes to request a temporary reassignment of state, territorial, local, or tribal public health department or agency personnel funded under federal programs. 1 out of every 4 immigrants are not accepted due to diseases, and this is a small ratio to prevent health-related diseases into the country. But at least it controls the health of legal immigrants and reduces immigration. I believe that the CDC rules for entering the country does reduce unhealthy immigration, and therefore I disagree with Ryan that states that the health-related grounds does not reduce immigration. It does, because America is concerned of who enters our country, and they are preventing diseases from attacking us. I believe that the CDC has a very tough role right now with COVID, but they are doing a great job. Thank you.